What is the Adonis Complex?
Oh, the Adonis Complex. Oh, yes. Well, the Adonis Complex is a term that I and my colleagues kind of invented to cover a broad range of body image concerns in men and boys. So it includes things like body dysmorphic disorder. It's kind of the popular term is body dysmorphia, eating disorders in men and boys, and something called muscle dysmorphia, right, which is a form of a type of body dysmorphic disorder. It afflicts primarily boys and men as opposed to women or girls, and people with this problem, have a distorted view of how they look. They're very concerned that they're not muscular enough, that their body build isn't big enough, when in the eyes of others they look fine, or sometimes they're actually quite well built and muscular, and but they have a sort of a distorted view of how they look, and it's troubling to people who have it. It's distressing. It often causes problems in their day to day life because they're so focused on how they look and so upset by how they see themselves.
Do you think this Adonis complex was a slow, gradual unfolding over time, or through your work, is there like a point in time that you really uh, look to where you saw like a big shift and change?
That's a great question. Body dysmorphic disorder has been around for a very long time. It was first described in the 1800s, right? So these are people who are obsessed with some perceived flaws in how they look. They think about it a lot. And by definition, it causes some significant emotional distress or interference in functioning, day to day functioning, whether it's going to school or getting to class, or you know, getting to meetings at work, those kinds of things. It's important to emphasize that because we don't want to call normal appearance concerns, which are so common in the general population. We don't want to give it a psychiatric name, right? So body dysmorphic disorder is problematic preoccupation with perceived defects in appearance. And again, distorted perception because other people can't see the defects that the person thinks they have. But the most common body areas of concern in body dysmorphic disorder are perceived defects of the skin, hair, and nose. Like they're going bald, but they're really not. Or they think that their nose is too large and others just don't see it that way, right? Often they're quite attractive people. So body dysmorphic disorder has been around for probably forever. We know it's been described for at least 100 and, oh gosh, almost 150 years now. But muscle dysmorphia is a little different. We think that's a newer form of body dysmorphic disorder. Now, it's possible that it's been around for a long time and that no one ever talked about it, and we can't say for sure, but we think that a lot of the societal pressures that young boys and men experience, and now in spades, really came into play, some point during the nine, maybe the second half of the 1900s, right? So 1960s, 70s, 80s, and that those pressures on boys and men to look big and muscular might not have existed prior to that. So, muscle dysmorphia may be it appears to be a newer type of manifestation of body dysmorphic disorder. Now, it's become quite well known, and I think the pressures on boys and men to be muscular and are sort of more powerful than ever, and really creating very unrealistic and sometimes harmful, um, you know, what's the word I want here? The images that boys and men are exposed to are typically are often unrealistic and potentially harmful. The super muscular look puts a lot of pressure on boys and men, right?
Do you think that, or do you know of, like, has muscle dysmorphia become the most heightened sense of body dysmorphia? Like, is that number one on the list now?
That's a great question. I No one knows the answer to that question. Um, we've had five good, well done studies from a scientific perspective of the prevalence of BDD, body dysmorphic disorder, in the general population, showing that it currently affects maybe 2 to 3% of people in the general population. Now, that may not sound like a lot, but it is a lot of people. It's many millions of people in the US alone. I suspect actually that body dysmorphic disorder is now more common than those studies indicate. It's just my guess because we haven't had a good study in about 15 years actually. And I suspect with all the pressures on social media and elsewhere, that body dysmorphic disorder, may be becoming more common, but we can't say for sure. Now, none of those studies looked at, how the prevalence of muscle dysmorphia compares to other forms of body dysmorphic disorder. So we don't know, is it now the most common form of body dysmorphic disorder or not? Probably not, but I think it's probably becoming more common, like other forms of body dysmorphic disorder. I just think that what everyone's online now, right? And what all the unrealistic images online and all the messages to be bigger and more muscular, and a fair amount of that is fake, right? People editing their images, and it's a lot of it is, and now with AI, who knows what's real and what is not real. And so I think there are just more and more pressures on people, especially young people, to attain these very unrealistic looks and potentially very, very dangerous, I think, especially in the case of muscle dysmorphia.
Yeah, and I feel like the justification for it is it's like, okay, this is how I build up my confidence. And I'd assume that like from the ages of, I mean, it's crazy to think that it could happen in like a 10, 11, 12 year old, but I would assume from like that age to maybe mid 20s or so, maybe closer to 30, I would have to guess that muscle dysmorphia is probably the number one type of body dysmorphia.
You could be right. You could be right. Um, I think it probably is more common than those studies that I mentioned indicated. Um, and you just look online and you just see these very unrealistic images of bulging muscles and encouragement to take potentially very dangerous drugs and supplements. And that's why I said earlier that I think muscle dysmorphia is a particularly dangerous form of body dysmorphic disorder, because if you take those drugs, you are putting your health at risk. And in many ways in which drugs, especially any anabolic steroids, anything with testosterone in them, very risky to take, and mental health risks. You get depressed coming off of them. Occasionally, people get manic on them. A heightened abnormal state of agitation, euphoria, etc. And people may be dying young from them. Some people, at least, that probably seems to increase the risk of heart disease, and not good for your liver and kidneys and other kinds of things. So, and then if you some people, this is so disturbing to me. Actually, reuse needles, share needles. There's that kind of risk as well. So, and can really harm a man's fertility. That's the other thing. You can get low libido, sexual dysfunction, and I've seen patients who wanted to get, were in a relationship, wanted to get pregnant, couldn't, and probably because of the anabolic steroids they were using. So, often that can come back once you stop use, but not 100% of the time. So that's muscle dysmorphia, and probably somewhere between 20 and 40% of people with muscle dysmorphia take anabolic steroids. So it's a risky thing to do.
I appreciate the fact that you say that like you don't know 100% because I feel like within this realm, like I feel like it brings new meaning to the phrase silent killer. Like yes, like in a
Yes.
literal sense, maybe it will kill you, but more so just like on an internal like emotional level, like people don't talk about this type of stuff or like it's just not like something that you would necessarily share. And I feel like just like from personal experience, like when I was younger, like I definitely struggled with it a little, like not to like a very serious degree of like taking drugs and like being completely, like overtaken by it, but like, I still work out very regularly. Like I eat very healthy, but like definitely when I was younger,
Yeah.
it definitely had like a consuming factor of my life. But it was more so of just like I loved the work that went into it. Like I loved like the discipline and the routine of like, working out and obviously seeing those
Yeah.
external positive results. But like it did become a little bit of a double-edged sword at times. And
Yeah.
I feel like I'm, thankful and grateful that it kind of just like naturally, you know, evolved out of my life, or like my obsession or like care for it like has just subsided naturally. Um
You're
what
glad about that, you said.
yeah. And like I don't think that was would have necessarily happened, but like there was a point in my life where I went through like really bad chronic pain issues, and it took me out of the gym and took me out of that type of lifestyle for, 6 or 7 months. So like I was like almost unwillingly like taken out of that type of like mindset and sort of like lifestyle. And I think long term that really helped me. But what I find so interesting about your work and how you got into this, because I know that this wasn't your natural intention of, okay, I'm going to get into, researching body dysmorphia. Like, what did you think the natural path of your work was going to be? And then how did you get introduced to this?
Yeah, well, when I got into this, which was quite a long time ago, no, no one had heard of these problems, really. Virtually no one. I don't think anyone had heard of muscle dysmorphia. So I and body dysmorphic disorder, even though it had been described in medical journals for more than 100 years, people back in the early 90s, professionals, the general public, for the vast majority had never heard of this problem. But I saw some people, some patients who had it. And I remember um, the, the first person I saw, or one of the very first patients I saw, was a young man who was very depressed. He was suicidal as a result of it. He couldn't work because he was so obsessed about his hair. He thought he was going bald. And it was devastating to him. Meanwhile, he's handsome with a full head of hair, right? And he thought he had very thin hair, receding hairline. He not even slightly, right? So again, you see this distorted perception. And I saw how it was ruining his life, this obsession with his hair. And body dysmorphic disorder isn't always this severe, but he was thinking about killing himself because of it. And there is a high suicide rate in people with body dysmorphic disorder. And he couldn't work and he was socialized. He was very isolated. So I just thought, oh my gosh, this is a serious problem. And why does no one know about it? That really motivated me. And when I went back and read about cases from, descriptions of patients from 1880 or 1920, there were some of them, no good studies. There's so much we didn't know about the disorder. We had no treatments. We didn't really, we knew next to nothing about it, but none of them described muscle dysmorphia, interestingly. And I had never heard of it. And so I think I stumbled upon it when I saw a young man who seemed to be wearing 6 layers of t-shirts. And a nice thing about being a psychiatrist is it's okay, when you're interviewing a patient, to ask about that. So I just said, I noticed you're wearing a lot of t-shirts, and I wonder, can you tell me a little bit about that? And it turned out he was trying to make himself look bigger. And so that led to my asking more questions, and then started asking more patients about it, and discovered that this seemed to be a form of body dysmorphic disorder where people were it was mostly men and boys concerned about muscle size, thinking they were scrawny and puny and not muscular enough, and they weren't. They looked normal, and some looked quite muscular because they often work out a lot. And so I just felt that this was early on in my career. And, I mean, some of my mentors discouraged me from going down this road because I think back then body dysmorphic disorder, muscle dysmorphia were confused with vanity. They are not. They are not. This is not about vanity. This is, it's a mental health problem where people have these obsessive thoughts that something's wrong with how they look. They have distorted body image. They're not seeing themselves accurately. And by definition, it's causing problems in their life or causing them a lot of distress. And I just felt I wanted to try and figure it out. I wanted to just start at the beginning. What are the symptoms people have? What co-occurring disorders do they have? How common is it for people to feel that life isn't worth living? How many have attempted suicide, and how often because of these body image concerns? And then, I moved on to trying to figure out treatments, what works to help people suffer less. And we now know, I've done a lot of treatment studies over the years, and now know that cognitive behavioral therapy, a certain form of cognitive behavioral therapy that focuses on learning skills to overcome the body dysmorphic symptoms, helps most people. And a certain type of medication, a class of medications called serotonin reuptake inhibitors, SSRIs or SRIs, they're called both. Things like Prozac and Zoloft, Lexapro, medicines people have probably heard of because they treat a lot of different mental health conditions, like depression and obsessive compulsive disorder. Those medicines are often really helpful. So, we've come a long way. Now there are a lot of other researchers in the field, not so much when I started out. There were just a couple of us, but it's amazing how much we've learned, through the science, through the study, the scientific research, the studies we've been able to do, and all the people who've been willing to participate in our studies. We've learned so much about, body dysmorphic disorder or muscle dysmorphia, and how people can get better.
I feel like when it comes to dysmorphia, it's a spectrum and there's
Yes.
different degrees of it. And I feel
Yeah.
like within today's day and age, I mean, majority, if not all of us, I think, are on that map. They're on that spectrum.
Yeah, I think it's probably increasing in prevalence. I think, most people have some what we call normal body image concerns, right?
Yep.
Most of us would change something about how we look if we could, right? But we may notice it. Oh, I have a little pimple today. My hair isn't exactly the way I like. I don't like this haircut that much. But we let go of the thought and we move on with our day. And, but that does at some point sort of morph into more, as you start thinking more and more about it, if it starts bothering you, you can't just let go of the thought, then you do start moving into body dysmorphic disorder, and muscle dysmorphia. And as you said, there's a range of severity. So someone with mild body dysmorphic disorder or muscle dysmorphia might think about how they look and be unhappy about it for an hour, a couple hours a day in total. They might, be moderately upset about it, somewhat depressed over it, and maybe they miss an occasional social event because of it. They don't want people to see them because they feel self-conscious about how they look, even though they look fine to everybody else. That's mild. At the severe end of the spectrum are people who are just completely disabled by these symptoms. They are housebound. They may just be in a basement, maybe their parents' basement, and not they've dropped out of college, they can't work because they're so obsessed with these perceived defects and how they look. Again, they look normal. They're socially isolated. They're thinking about suicide. Some commit suicide because they're so obsessed with these perceived imperfections, flaws in how they look. So, an example of very severe muscle dysmorphia, you can see the same kind of symptoms, just very socially isolated, not wanting to be seen because you're afraid that you look so puny and tiny. And, or some maybe, I remember seeing people who just, exercise. I mean, excessive exercise is a symptom, right? And just exercise so excessively that they damage their bodies. I saw one man a long time ago who was maybe about 40, but in a wheelchair forever, probably, because he had exercised so excessively. He really damaged, you know, muscles, maybe nerves, maybe I can't remember exactly whether his spinal column had kind of collapsed because he was putting so much weight. Um, don't remember how exactly it happened, but he just had ruined his body by working out so much. And then there's the excessive attention to diet, right? And eating lots of high protein, low fat meals. And sometimes that just the exercise and the attention to diet and have feeling you have to gorge yourself on the foods that build muscles, that can just kind of take over someone's life. So, I've seen many people who've missed social events because they had to go to the gym instead, right? They felt they had to go to the gym they'd just been there 2 hours before, but they had to go again, right? Because maybe they were starting to waste away. And so their girlfriend wanted to go to the gym and or wanted to go out, to a movie or something, like, no, I got to get to the gym. So having to go to the gym, the exercise, the attention to diet can start taking over healthier activities.
I find it really interesting that, so like if somebody who's suffering from this severely, they would see it as, okay, this is a physiological, concrete problem that I'm dealing with. But I feel like a key word, and it's the truth of what you have to see it as, it's all perception and psychological. And
Misperception.
yeah.
Yeah.
And when it comes to specifically muscle dysmorphia, do you have an understanding of the breakdown? Because I see it like muscle dysmorphia as like two different groups. I see it as, okay, there's like a group of people that like they understand how to build muscle. Like they know how to work out in the gym, they know how to eat to build muscle, and then they just have this unfillable hunger for more. Like
Yeah.
just like wanting to, okay, like I've gotten a taste of it, I've seen the results, and now I just want it to the nth degree. I see that as one group. The other group that I see it as is like, okay, they don't know what they're doing. They are looking at, the next gimmick, the next quick thing, different products that will help them build muscle, and nothing works. And then they just get into this like sense of hopelessness where it's like, oh, I can't build muscle. Like, I'm just withering away here. Like, do you have an understanding there between like those two groups, or like, do you see it that same way?
Yeah, I think there are different groups, subgroups like that, but they all, based on what you said, if they're obsessing about their body build,
It
and
all comes back to the same thing.
it
Yeah.
all comes back to the same thing. I mean, the thing is, typically in muscle dysmorphia, no matter how big you get, you're not satisfied.
Yeah.
Feel like it's never big enough, and you're still too small. There's more you should be doing. You need to join a better gym, more gyms. You need to build even more. You need to try the next new supplement. You need to take lots of supplements. That you're going down the rabbit hole there, right? Um, because there's an endless array of stuff you can buy online, and it's not just the anabolic steroids that are potentially dangerous. It's other stuff too. I did see someone a long time ago who went into kidney failure. That's a very serious problem. That's very, very serious if your
From
kidneys.
taking steroids or doing
He
other
was taking
stuff?
about 50 to 100 supplements, and people think supplements are safe, and some are, like standard multivitamins or something like that. But they're not regulated by, they're barely regulated by the FDA or anybody else. And so, and that be hard on your kidneys, hard on your liver. You never really know what's in them. I mean, a lot of them don't have in them what the labels say. They can have, some have anabolic steroids in them, and that's not on the label. It can be anything. You're putting stuff into your body that can, who knows what it really is. So, um, yeah, you have to be really cautious and careful. Um, and I think, you know, the less of that you take, the better. And we do have treatments that work, as I mentioned, the cognitive behavioral therapy and the serotonin reuptake inhibitor medications. They're not addicting. They're safe. They, there are a lot of unfortunate misconceptions about them, but most people have no side effects at all, and they often can really, really help. They can be life saving, actually, especially if you're more suicidal. They can turn your life around in a good way.
I feel like in a paradoxical sense, or at least that this was like my experience to a degree when I was younger. I feel like body dysmorphia or specifically muscle dysmorphia, it can give you a perception of control or a sense of control because you think you know what the answer is. Like you think you know, okay, like when I look like that, or like when I have this type of external image, or like if people see me this certain way, then like that's when I'll be good. And that sense of knowingness like gives us like some sense of like autonomy, and we think that like okay, everything's fine here,
Yeah, yeah.
but it's the exact opposite where it just gets you
Right.
deeper into
Yeah.
the hole.
Deeper
And
into the hole.
I feel like the answer isn't a solution, or it's like okay, like that's what's going to help me, but it's more so of a question, because whether it's body dysmorphia, muscle dysmorphia, or I feel like just anything within our culture and society today, whether it's food, social media, all different vices, I think the solution starts with a question, which is what's the void I'm trying to fill. Like I feel like that's what it comes down to. It's like okay, there's some type of, whether it's consciously or unconsciously, there's a void within me that I'm trying to cover up. What are your thoughts on that? And have you seen within your work like any like types of void that you see more than others?
Yeah, I think to go back to the control issue, I think, yeah, I think that there's this illusion of control, actually, that if you just work out a little harder, take the next great supplement, you do what the most popular influencer tells you to do, you'll get there. You will be big enough and muscular enough. And of course, as you said, you just go deeper into the hole. No, it doesn't work that way because of that distorted body image. It's kind of like anorexia nervosa. If you're familiar with that, it mostly affects women and young girl, and girls, thinking, trying to get thinner and thinner and thinner, even to the point where they sometimes die from it. But it's this feeling you can never get thin enough. But you see the distorted body image there, right? They think they're fat, but they might be 65 pounds and 5'7", right? So muscle dysmorphia, in fact, used to be called reverse anorexia because it's kind of
Oh
the
wow.
opposite of that. Yeah, it can never be too big, right? Um, and but you don't get there. Nothing, the treatments I mentioned will get you there, right? Because they'll help stop those obsessive thoughts and help those thoughts be less distressing and often improve body image so you see yourself more accurately. To go back to the void, your excellent void question, the cause of body dysmorphic disorder, including muscle dysmorphia, almost certainly it hasn't been as well studied, is it's caused by like all mental health disorders, it's caused by a combination of genetic risk that you inherit from your predecessors, parents, and other, blood relatives, and so-called environmental influences. Like maybe you were teased when you were younger, maybe you were bullied. Not everyone who was bullied when they were younger gets muscle dysmorphia or body dysmorphic disorder, but it might increase the risk. Um, so the cause of it isn't just about an internal void, right? There are these other factors that are causing the body dysmorphic disorder. But I do think that's a helpful and valid perspective to think of a void. And I do, although it's interesting, the treatments can just take that right away. It can really, it's amazing if you take a medicine that it can, the void can fill up. It's fascinating, isn't it? But I think, we find that people with body dysmorphic disorder, with muscle dysmorphia, tend to, we work on self-esteem in our cognitive behavioral therapy. We work on self-esteem because we find that people with these disorders tend to overvalue the importance of appearance. Appearance is a big contributor to their self-esteem. I don't think that makes you vain. I think it came from somewhere, probably from some life experience you had. And a lot of people with this disorder don't want to be unusually attractive. They don't, they just want to look kind of normal and fine, and not scrawny and not t- tiny and that kind of thing. And they often don't pay much attention or adequately value other positive aspects of themselves. They don't necessarily value their athletic ability, their musical ability, their artistic ability, the fact that they are a good friend to others, the fact that they have whatever you consider good values, that they are helpful to others, that they're a good student. We're all made up of all kinds of traits, values, personality characteristics, some positive, some negative, right? We're all a mixed bag. But people with body dysmorphic disorder and muscle dysmorphia tend to really discount and not even notice their positive traits. And so I think that's often where the void is, and that they're sort of counting on their physical appearance to make them valuable or acceptable in the eyes of others. And not to say that appearance doesn't matter at all, but typically, ask yourself, what do you value in other people? What do you value in your friends? If you have a partner, what do you value in them? Is it how big their biceps are? Is it how thick their hair is? Not typically. Usually it's because they're fun to be with. They treat you well. You have shared activities you like to do. They're a good person, whatever. You can come up with a long list, right, of things you really value in others. And those are things that tend to keep relationships going, right? Relationships that are based on how good your hair looks or how big your calf muscles are. Those relationships probably aren't going to last very long. So in our therapy, we do work on helping people recognize and value other aspects of themselves and try and help them fill that void that they're feeling. They don't have to rely on their appearance to feel good about themselves and be acceptable to other people.
Yeah, that resonates on a deep level. And I feel like for me personally, like I said, when I struggled with this to a degree, like it wasn't bad, but it was like I had an understanding of it. And like when I grew out of it, like I said, I still, work out a lot. I eat very healthy. I eat very, disciplined, but it's like the physical actions haven't changed, but it's just like the it's just coming from a different consciousness. Like it's coming from a different level of awareness and understanding of like, hey, I'm just doing this to do this. I'm not doing this for, XYZ to, results afterwards.
And that to feel good about yourself, you don't have to rely on having perfect hair or the biggest muscles or that
Yeah.
sort of thing.
Yeah, it comes more from a because I think it's really fascinating. I feel like wellness has become a much more popular term, and I feel
Yes.
like you're going to continue to see wellness become more popularized and fitness. Like my hot take is like maybe in like 20 or 30 years, like wellness is a more acceptable word, and fitness has become a little bit more obsolete because I think fitness is just like that one dimensional sort of physical versus like wellness
Mm-hmm.
involves the physical with the mental, emotional, spiritual. So it's just
Yes.
a more balanced way of going about things.
Right. And just, I agree. And I think just to follow up on something you've mentioned a few times, that you work out, that you eat well, those are fantastic things to do, of course, right? So Exercise is great for your brain. It's great for your mental health and physical health. And of course, eating well. We're hearing more and more about ultra processed foods, all their evils, right? So, eating a healthy diet is great. Not a lot of junk food, and eating like the Mediterranean diet, but is fantastic. But with muscle dysmorphia, it all those good things get carried to an extreme, right?
Yeah.
So the solution isn't stop going to the gym, stop eating well, right? No, no, we just want to recreate a healthy amount of those things so that you're not working out so much that you're damaging your body or sacrificing your social life or missing class. You're not eating so much that you're missing work meetings because you have to run to your blender and make a shake, and you can't focus without doing that. So we're trying to help with our treatments, the medication, the therapy, get those obsessive thoughts and compulsive behaviors, get those under better minimized, right? So that you you lead a healthy lifestyle and you don't carry the exercise or the diet to an unhealthy extreme.
You asked the question in your book, why has the public become so fascinated with this topic? And I have an interesting hypothesis on this. And
Yeah.
part of the reason that I wanted to have you on the show is because I recently had on a woman named Gina Bontempo. She wrote this book called Fat and Unhappy, and it's all about the body positivity movement and just looking at it from a very transparent sense of just like how that has become unhealthy as well, where body positivity has gone into an extreme to an extent where it's become like fat acceptance and just like an acceptance of obesity. So just like going all the way on the other edge of things. So I wanted to have you on to kind of balance that out where it's like, okay, well, like let's talk about what can happen on the other side of the coin.
Mm-hmm.
But I think, and what I find fascinating, this is what my hypothesis is for like why body dysmorphia within the public and culture and media has become more apparent and people are talking about it more is because of body positivity, where it's like I feel like body dysmorphia
Mm-hmm.
in a weird way has become like the fuel for body positivity, where body positivity activists, like, they will try to disown it, but I feel like it's also in a weird way become an important part of the agenda, and like they like it because it just pushes the body positivity movement even more. What are your
The body
thoughts on that?
dysmorphic disorder does.
Yeah, I feel like body dysmorphia is kind of like a fuel or a lifeblood for the body positivity
That's
movement.
interesting. It's I hadn't thought about it that way. So that's appreciate your insights about that. I think body positivity can mean a lot of different things, right? I think in general, much of the time, it's a helpful concept, right? Just to say though that body dysmorphic disorder. So I'm not talking about not talking about normal body image dissatisfaction, which is pretty common in the general population. But when it becomes kind of obsessive and causes problems for you, I think simply approaching it with body positivity is not probably not going to help you feel much better, right? I think it's a mental health condition that you need one of those two treatments for that I mentioned, the serotonin reuptake inhibitor medicines or cognitive behavioral therapy that's focused specifically on BDD. So I think body positivity probably not an effective treatment for body dysmorphic disorder. However, for people with more normal body image concerns, they're not as problematic, they're not as extreme. Body positivity can be a helpful thing. I think, so many people grow up with shame around how they look, right? And teasing and bullying is unfortunately pretty common. And probably most of us have been teased at some point in our lives about some aspect of how we look, right? And some people really take that to heart. And so I think realizing that shame about how we look is not helpful. And body positivity can be a helpful thing. Now, in a helpful perspective, it's not going to treat body dysmorphic disorder but for less problematic appearance concerns. But I think, that the body positivity too, as you imply and are stating, can be carried to a bit of an extreme, right? And, I think when it comes to obesity, we know that's not good for your health. So I think for people with obesity, body positivity can be helpful in the sense of no need to shame yourself over it, no need to denigrate yourself over it. If other people shame you over it, you don't have to accept that. But it is a healthy thing to try to get your body weight back into the normal range, right? You're going to reduce your risk of a lot of illnesses, right? And diabetes, and which then brings, increases the risk of heart disease and stroke and kidney failure and all these kinds of things. So I think, it's a matter of not shaming yourself, but just saying, hey, I have this medical problem. Obesity is a medical problem. How do I want to tackle it? And work with a doctor to try to get your weight in a healthier range. So I don't think body positivity has to imply, or it shouldn't imply, that you don't want to do anything if you're very overweight. It's good for your health to do something about it.
There's obviously a lot of societal and cultural factors at play when it comes to this conversation and people being consumed with this. But I'm also curious to know, like, is there to a degree some type of mammalian innate instinct
Yeah,
of people who are like, all right, at the end of the day, it's my animal brain that wants to, get bigger and me, more
yeah,
dominant compared to others.
yeah. Just remember, we don't, our brains are not simply animal brains, right? Of course, so that
Yeah, yeah.
you're not a slave of an animal brain. But I think your question is great. It has probably some validity. We don't know for sure, but body dysmorphic disorder, muscle dysmorphia almost certainly have some sociocultural contributions, right? We've talked about that. Boys growing up with these super muscular action figures and, wanting to look like Superman and, what we're seeing on social media these days and these super muscular bodies, right? Some of which are fake. They're only attainable with drugs. I mean, these influences are clearly important. And certainly for women, we've known that for a really long time, the pressure to be thin and all that. So all of this does matter. But there's probably an evolutionary basis as well, and more of a biological evolutionary basis. Um, because being big, may have some evolutionary advantages, and maybe especially for males, bigger, stronger, you know, you're going to maybe do better in a battle with the mastodon or the enemy behind the mountain next to you. There may be an evolutionary basis for body dysmorphic disorder. We know, for example, symmetry is a common concern of people with body dysmorphic disorder. Oh, my nostrils are a little asymmetrical. Well, everyone's are, by the way, but people with BDD really think that looks horrible, and no one else is noticing, but they see it, right? And or my face isn't perfectly symmetrical. Well, it isn't for anybody really, but symmetry is a common concern, and we know that in the animal world, having moths with symmetrical wings get more mates, right? So there's something about symmetry reflecting perhaps reproductive health and fitness. So there probably are evolutionary roots to this disorder, but that's not going to be the only cause. There's the genetic contribution, there's the sociocultural contributions. The causes of all mental disorders is complex, right? There's not one thing that or one factor that's the cause. And just as I started out saying, even if this does have evolutionary roots, we are more evolved than that, and we don't have to accept, right, that bigger's better. I should mention, by the way, and I and my colleagues talked about this in our book, The Adonis Complex, that my colleague Harrison Pope, who was actually the first author on that book, The Adonis Complex, did some studies in which he found that women actually, so for heterosexual males, women don't prefer a supermuscular body. They prefer a more ordinary male body, right? And so I think sometimes men may misperceive what women find attractive, and I think we see that with women also. I think they often that men may not prefer as skinny a body as women think they want, or that the women themselves want. So I think there are all kinds of misperceptions going on here in these body image disorders.
Building off that conversation of gender and gender relations, something else I had a thought of was, so we've been talking here strictly in terms of the language dysmorphia. Another word that I've heard used is dysphoria. Is there a difference between dysmorphia and dysphoria? Like, I've only heard dysphoria used in terms of gender dysphoria. And when
Right.
I was thinking about that,
Hmm.
like, I feel like, in a way, especially when you bring, steroids into the conversation, maybe it's not like as far as like, okay, that's gender dysphoria, but it feels like kind of like in the same conversation, in a way, where like you just like those types of people who go to that length like don't feel good within the natural makeup of their body. Like, are dysmorphia and dysphoria interchangeable words, or no?
Um, Not really. I mean, the official term for body dysmorphic disorder is body dysmorphic disorder. It's often the term muscle dysmorphia is used a lot, which you've been using. I mean, the problem with muscle dysmorphia is it can refer to a lot of different things, I think, and there's no one agreed upon definition. So sometimes when you hear muscle dysmorphia, people are talking about, or I'm sorry, body dysmorphia. People are talking about body dysmorphic disorder, which I've defined a couple times. Sometimes they're using it to refer to body image concerns in people with an eating disorder, right? Sometimes they're referring to people with anorexia, bulimia, one of those disorders which involves body image concerns. And sometimes it's used to refer to more normal body image concerns, which aren't necessarily very problematic, right? We all occasionally have a bad hair day, or, we're not always 100% satisfied with everything about how we look. So the problem with the term muscle dysmorphia is sometimes it's unclear. Is it referring to normal body image concerns? We don't need mental health treatment for those. Is it referring to eating disorders, or is it referring to body dysmorphic disorder? Those two things require somewhat different treatment. Um, Body dysmorphic disorder does involve dysphoria. Dysphoria meaning sort of an unpleasant internal state, unhappiness. Um, it's a broad term. Could include some anxiety, some depressive feelings, etc. So, you know, f- from a kind of an official name perspective, it's not body dysphoria, but body dysmorphic disorder does include dysphoria, that distress, that unhappiness. Um, it has some similarities with gender dysphoria and some differences. I mean, both conditions involve dissatisfaction with certain aspects of how you look. But gender dysphoria is different because it really focuses on most often secondary sex characteristics, genitals, breasts, and feeling, that their identity is not congruent with their assigned gender, and that their physical body is not congruent with who they really feel they are. And so, you don't see that in body dysmorphic disorder. And the treatments are quite different, so, um, you know, that they have the overlapping feature of dissatisfaction and problematic, distressing dissatisfaction with some aspect of how you look, but there are some important differences between them.
Diving deeper into the steroid side of things, and what I found really interesting about your work, and I feel like just within the everyday nature of how we understand steroids, we just simply think of the physical, and obviously that's bound to happen because the biggest changes you see are physical on the surface, and then we only just I feel like talk about the physical side effects really, and what I've found
Yeah.
really important and beneficial about your writing in your book, The Adonis Complex, is like, okay, like, yes, there are a lot of physical side effects, but that is more, you're going to see that more long term, most likely, compared to the mental and the psychological, which can be the real danger. But I feel like that isn't talked about at all, really. Can you just explain more of that about like the mental and the psychological side of
Sure.
steroids?
Sure. And maybe one thing I should mention is that there are two different types of steroids. There's the kind of steroids you might take if you have an inflammatory disease or you have asthma or something like that. Those are fine, right?
Yeah.
They're very different from the anabolic steroids, which build muscle and have the negative physical side effects I've already mentioned, often speeding up heart disease and can be bad for your liver, kidney, etc. Um, yeah, the mental health side effects. People have probably heard of something called roid rage. They can make people very aggressive, and I think we have some anecdotes in our book, The Adonis Complex, about guys who just usually nice guys, not aggressive, not violent, and they just when they're on steroids, they'll throw a rock, a brick through a window, nearly, missing their girlfriend's head by a hair, so, or starting fights on the highway, someone cuts them off and, it's so people can get very aggressive on these drugs. And sometimes, if you end up harming somebody else, that's a problem, right? For them.
Just diving deeper into that because I'm curious. So
Yeah.
like when that happens, like like what's happening on a physiological, psychological, or neurological level for that shift?
Well, I don't think we've studied roid rage quite enough to really know
Okay.
that. But, testosterone, is associated with, a little bit more, a little, not aggression, but, milder versions of that, right? So I think it's just it's an extreme version. And most men are not violent or aggressive. They have higher levels of testosterone than women, but they're not violent or aggressive. I think just when you take it to that extreme, testosterone is known to increase the fight tendency, right? If you take too much of it. Um, and then there's also people can get quite depressed when they try to come off of steroids. It's good if you want to come off of, certainly it's always good to want to stop them. And, a primary care doctor or sometimes an endocrinologist gets involved, can help with that. If you've lost your fertility and want to get your fertility back, or you just are tired of the shrunken genitals and the hair loss and the low libido, those are all things also that are side effects of testosterone. So it's interesting. I think, people, we focus a lot on, the longer term potential consequences, but some of them are, the physical side effects are potentially shorter term consequences. So, I think people can get quite depressed coming off of them. An endocrinologist can be helpful with that. Sometimes a psychiatrist will get involved. Sometimes people become suicidal. So, if you try to come off of them, good for you that you want to do that. But if you find that you are getting very depressed or suicidal, you certainly want to seek professional help and try and get some help to as you come off of them. Occasionally, we see people get manic, which is not a good thing, because it can be a state of euphoria, but sometimes there's a lot of irritability mixed in there, or even depression mixed in, and agitation and um, excessive impulsivity and things like that. So, and these drugs can be addicting. I mean, you can get addicted to them. So it's just better to stay off of them and just be wary of all the supplements out there, because some of them have these drugs in them and don't say the label doesn't indicate that. So
It
your
may
best
be a little,
just working out a healthy amount, eating
yeah.
a healthy diet, not overdoing it, and realizing that what makes you you and is not just the size of your muscles, right? It's not what it's it, you're so much more than that. And women don't even prefer, on average, there may be some exceptions, but don't even prefer an excessively muscular look. Men are, tend to think they do, and they don't necessarily. They often don't. So, and there's just so much more to you as a human than your muscle size. And, you really, ironically, I think there can be a feeling of wanting to be more masculine, right? That somehow muscle size can be associated with masculinity. But then if your testicles start shrinking and your libido goes down the tubes, and you can't get an erection, then that's not so consistent with standard concepts of masculinity, right?
Yeah.
So there's a bit of an irony there.
Yeah, you think you're taking these things potentially, to boost your confidence, and there's so many things that can happen that just do the exact opposite. And it may be a little bit of a, radical take when it comes to steroids or just like any type of augmentation to, to your physical self. Like, I believe, like, obviously, like, manipulating your biology in this way can be very, very physically and, neurologically dangerous.
Yes.
But going to what you're saying of like, hey, like, you're so much more than this, of like just being your body. Like, I also see it as being very morally, ethically, and even spiritually dangerous in a way too. And I want to go to a few quotes in your book. You say, in the course of our research, we've done numerous statistical analyses to see if there was some particular personality variable, some biological test, or some aspect of family history that would predict who would develop these bad reactions, but none of our hypotheses has worked out. Violent reactions to steroids seem to be completely idiosyncratic and unpredictable. So it's kind of like you're taking a gamble here. Like you're kind of just like you're taking a huge risk that you don't 100% know. And a common theme that I also pulled from your writing, and it goes to the language that you use in a few different sections. You say, what happens when you violate nature's limits? Nature made them that way. It's unhealthy to maintain a body completely different from the one that
Yeah.
Mother Nature gave you.
Yeah.
And I think that's really important for people to understand, of like this concept of this is who I am, Mother Nature, like this is what I have. Like, and it's kind of like when it gets to this, okay, you're taking the gamble, it's what you can also see it as, it's like, hey, don't test Mother Nature here.
Yeah.
What do you see as
It's a great way to put it.
yeah, what do you see as Mother Nature, and especially like getting it? I feel like there is a spiritual component to this conversation, and how people can. That's where I was also getting into, filling the void. I feel like a lot of the time that could potentially be like, hey, some type of spiritual or just like deeper knowing of like who you are as a person, and getting more in touch with like your soul rather than simply just your physical body.
Oh, I agree. I agree. And again, not to blame people with this
Yeah, of
problem,
course not. Of course.
not to shame them, not, and again, it's not body dysmorphic disorder and muscle dysmorphia are not vanity, right? It's their mental health conditions, right? But I absolutely agree with your perspective. And it is one of the things we do in our therapy, which is trying to broaden your sense of who you are and pay attention to the different components of yourself, what other people value in you, It's easy to discount all of that. If you have any inclination to go down a spiritual road, however you define that, that's wonderful. To find meaning, to value aspects of yourself you may have been ignoring or even devaluing. So, yes, I agree. So much of this is about not putting all of your eggs in that appearance basket. Your body's going to change, it's going to age, it's just going to happen, right? And it's it's not primarily what other people value in you. It's not going to make a relationship work over the longer term. It's, yeah, expand your view, value your strengths, um, things other people appreciate about you, um, the good things you do in the world, your purpose, and your spiritual journey if you're on one. I think these are all incredibly important things to try to encompass and focus on. And the treatments I mentioned will help people get there, definitely, because they're not bombarded by these obsessive thoughts and these compulsions to go to the gym and work out a little bit more. But that broadening perspective, just realize you're so much more than the size of your calf muscles. You are a full human being, and everything that comes along with that, right? So, and also, I just also say realize that a lot of what you see online is fake. When it comes to muscle dysmorphia, especially, I'm not saying in general, although that's going to become more of a problem, right? But a lot of what you're seeing online with the hypertrophied, massive muscles, it's a product of drugs. It's not necessarily a product of working out or being healthy. And now, with AI and I think we're moving beyond photoshopping, but even with that, a lot of what you're seeing isn't real. So don't feel you have to attain that. It makes no sense, actually, as you said, as we said in our book. Mother Nature didn't intend that. If you're heterosexual male, women don't tend to like that either. I've seen quite many men, some were not in a relationship because they felt so ashamed of their bodies, right? But some were, and I can say the partners almost always, if the guy was using a lot of supplements, was using anabolic steroids, the partners were pleading with them to stop, just stop. They could see, the negative effects. So for the sake of your relationships, for your own sake, it's best to get treatment if you think you have muscle dysmorphia or body dysmorphic disorder more broadly, other body image concerns that are problematic, because we have really good treatments.
The last thing that I want to finish up with, and I think it's the most impactful part of your work and especially your writing, is that it seems like it's largely coming at it from the lens of storytelling and understanding body dysmorphia on a macro level by really getting deep into the micro and the anecdotal experiences of it. And one of my favorite lines from the book is, "A couple of stories from our patients, better than any statistics, tell of this pain." What do you think, or what would you like to see the future of this story, so to speak, to be?
Well, we need both. We need the scientific research studies and we need the stories also. I didn't know what research studies to do until I had heard from many people with body dysmorphic disorder and the muscle dysmorphia form. I'm so grateful to all the people I've ever treated, all my patients who've opened up and have been willing to trust me with their stories, because there's so much shame that these conditions cause and embarrassment. And yeah, and so listening to the stories is so important, and I think is a wonderful way to help others understand what the condition is like, and especially sharing improvement, right, with the treatments we've talked about. the scientific studies are also critically important because that's really the only way you know what treatments really work and what don't. And so I've done both in my career, and but started off telling the stories, back in 1996 when I wrote my first book, The Broken Mirror on Body Dysmorphic Disorder, and then subsequently in the Adonis Complex. So I think the stories are very important. I think we have a lot of reason to be hopeful about the future. Hopefully, the word is getting out that we have good treatments for body dysmorphic disorder and muscle dysmorphia. Hopefully, more good treatment studies will be done. We are learning a lot more about what's going on in the brain of people with these conditions, why they misperceive what they see. And that may lead to more treatments that may be helpful in addition to the ones we already have. So, I think we have a lot of reason to be hopeful for the future.
Dr. Phillips, it's been great speaking with you today. Is there anywhere that you'd want to send people, or if people want to learn more about you and your work,
Oh,
anywhere that they should
sure.
go?
Yeah, I mean, I've written a lot of books. So, The Broken Mirror, and then an updated version, Understanding Body Dysmorphic Disorder, um, sort of a textbook that's more for professionals. In 2017, I have a website. People want to come check out my website. It's Katharine, Katharine Phillips, two L's, MD at md.com. Yeah, I should know the address of my website. I've published a lot in scientific journals also. Check out the Merck Manual. It's free online. And you can read about body dysmorphic disorder and other related conditions. So yeah, there's a lot I've written that's out there. Other interviews with people like you on YouTube and other places. So, and thank you for doing this interview because it really helps to get the word out that this is a common and treatable problem. So I appreciate that.
Awesome. Yeah, it's been great speaking with you today, and I really enjoyed the conversation.
Thank you.